everyone, and welcome to the sixth HealthLinks webinar of 2024, Food at Work, a total worker health approach to healthy eating in the workplace. We're really happy that everyone's here. We see all of our participants logging in and joining us. So for those of you returning to see us again, thank you for being here. For anyone that's new, welcome to the HealthLinks webinar series. We're happy to have you here. Today, we're going to be talking about the importance of nutrition and healthy eating, food at work, and how that impacts our bodies, how that impacts our ability to be productive employees and team members. And we have a really great set of speakers that will be joining us today. Just a few housekeeping items. My name is David Shapiro. I use he, him pronouns. I am a white male in my late 40s, and today I have long, dark, curly hair and large gray rim glasses. I'm joining you from Aurora, Colorado on the Anschutz Medical Campus. We want you to use the chat function to tell us where you're joining us from. We're always so proud to see all the states and all the countries that participate in this webinar. So use the chat function, tell us who you are, where you're joining us from. However, when questions come up for our speakers today, we want you to switch over and use the Q&A section of your Zoom toolbar. So use chat for telling us who you are and any technical assistance you need. Questions, we'll have you use the Q&A chat bar. All of our participants are on mute for the duration of today's presentation. And closed captioning is available for those of you that need that. Please use the Zoom toolbar for accessing closed captions. We know how important it is for those of you that are claiming continuing education credits, especially CHES and other credits. Stay tuned. Through this webinar, there will be a survey that pops up at the end of the webinar, and that's how you go about claiming those CHES credits. We will also have a link available to that survey towards the back end of our hour together. And this webinar is being recorded, so you'll be able to share the recorded content with colleagues who may have missed it after today's session. We always start with a land acknowledgement from the University of Colorado. I'll read that now. As we gather in this virtual space, we honor and acknowledge that the University of Colorado's 4 campuses are on the traditional territories and ancestral homelands of the Cheyenne, Arapaho, Ute, Apache, Comanche, Kiowa, Lakota, Pueblo, and Shoshone nations. Further, we acknowledge the 48 contemporary tribal nations historically tied to the lands that comprise what is now called Colorado. Acknowledging that we live in the homelands of indigenous peoples recognizes the original stewards of these lands and their legacies. And with this land acknowledgement, we celebrate the many contributions of Native peoples to the fields of medicine, mathematics, government and military service, arts, literature, engineering, and more. We also recognize the sophisticated and intricate knowledge systems indigenous peoples have developed in relationship to their lands. We recognize and affirm that the ties these nations have to their traditional homelands and the many indigenous people who thrive in this place alive and strong. We also acknowledge the painful history of ill treatment and forced removal that has had a profoundly negative impact on Native nations. We respect the many diverse indigenous peoples still connected to this land. We honor them and thank the indigenous ancestors of this place. The University of Colorado pledges to provide educational opportunities for Native students, faculty, and staff, and advance our mission to understand the history and contemporary lives of Native people. So a little bit about our program. HealthLinks is a public health outreach program where we put the total worker health approach into practice with organizations really of every size and in every industry. We are champions for health and safety and work, and we really take a broad, holistic approach to worker health, safety, and well-being. Our centers, the Centers for Health, Work, and Environment at the Colorado School of Public Health, are located on the University of Colorado Anschutz Medical Campus, and our primary funder is NIOSH, the National Institute of Occupational Safety and Health, at the Centers for Disease Control and Prevention, the CDC. So just a quick disclaimer, the views presented in today's discussion belong to each of our presenters, myself and the other speakers alone. We do not represent the perspectives of the centers of the Colorado School of Public Health or more broadly of NIOSH or the CDC. Our agenda today is we'll have an introduction to the federal food service guidelines and what food at work means to us and to total worker health. We'll go into a discussion with speakers that include putting the federal food service guidelines into practice, what that looks like in practice for an organization, for a hospital in this case. And then also a key topic on this area is how do we sustain, maintain, and start to utilize more plant-based options for food. And so we'll have a conversation about introducing plant-based options to the Food at Work offerings as well. And then we always like to leave time for question and answer. For those of you that have been with us through our series, we generally don't always have time for all the questions that come up, but we do our best to answer them both in the Q&A section of Zoom as well as through our panelists. So be thinking about the questions you have for our speakers as they're speaking, and our hope is towards the last end of the hour, we have enough time for the Q&A section of today's conversation. Our learning objectives are really to be able to have you assess the food environment at your workplace and thinking broadly about what the food environment means, considering the nutritional value of your offerings, the accessibility of it, and employee preferences as well. So be thinking about break room foods, what's put out in the break room, vending machines, wherever food is consumed, if it's consumed at work. It doesn't have to be food that's sold in a cafeteria necessarily, although we will hear a little bit more about that today. We just want you to start thinking about how people serve, sell, and consume foods at your workplace, and thinking about how to integrate more healthy eating strategies in that. We know that our bodies and our brains are obviously really connected to the food that we ingest, and it affects our ability to perform as workers. So the HealthLinks program has been recommending healthy eating and active living, providing education on food and nutrition to companies really since our inception 11 or 12 years ago. But today, and with our partners that we have on today's webinar, we're really in a more intentional way putting that into practice with employers in our network, and we're hoping you put it into practice as well. And then also we want you to think about how you can implement evidence-based nutritional strategies like the Federal Food Service Guidelines to support employee well-being and promote healthier food choices in your workplace. Again, thinking broadly about food choices and food services at your workplace. So with that, we're going to start by launching a poll to today's session. We want to know if you serve or sell food at your workplace. So hopefully the poll has come up for you now. This helps our speakers better understand who you are, where food may be available. And so the question is, when you do serve or sell food at your workplace, choose as many of these options as make sense to you. Cafeterias, cafes, and concession stands is the first option. Vending machines, meeting or break rooms, events, which include catered events, food trucks, and more. Meal programs like those in hospitals, schools, and carceral settings, or the option of we don't serve or sell any food in our workplace at all. And we'll give you just another few seconds here to respond to this prompt. Great, we're seeing a lot of you fill this out. It's great to see some of these numbers, and we'll share the results in just a moment here. Great, we're at about 400 responses. So let's go ahead and share the results of the poll. And so for those of you, not able to see this on the screen, and for our fellow panelists and presenters, we've got 37% of our audience that says that we do have cafeterias, cafes, and concession stands. Almost 50% having vending machines, not surprising there. 40% have food in meeting or break rooms. Just over 40% have food services in events like catering and food trucks. 12%, still a pretty high number there, with meal-specific programs. And then 25 or 27% do not serve or sell food at all in your workplace. And so, over 70% of participants on today's webinar serve, sell, have food available in one of the venues that we talked about. So that's great information for our speakers and panelists. And with that, I'm going to go ahead and introduce our first speaker of today, Inka Deku. Inka is the Nutrition and Integration Specialist at the Colorado Department of Public Health and Environment, or CDPHE. She is a registered dietitian with a master's degree in nutrition. And in her role at CDPHE, Inka is the subject matter expert for food policy, systems, and environmental change grantees. Inka also works with other state agencies, local public health agencies, statewide food advocacy organizations, community-based organizations, and charitable food systems to increase access to healthy food and beverage, healthy food incentive programs, and policies to improve the nutrition environment. Inka, it's been great working with you and your team. So thanks for being here today to give us this overview. I'm going to go ahead and start sharing my screen here. Just give me 1 second to pull that up. Great. So we've got your slide, Inka. Thanks for joining us.
Thank you, David. Hi, everyone. As David mentioned, my name is Inka. I'm showing up today as a 43-year-old white female with long, dark blonde hair and glasses. And so, yeah, I'm just really excited that I get to share information with such a large audience on what are the federal food service guidelines and why they are important. And so the food service guidelines, as what I will refer to them, or FSGs, they were released in 2011. So they've been around for quite some time, and it's a set of practices to increase healthy and safe food options for employees and visitors. And so these guidelines are really designed to encourage healthy food and beverages, really thinking about the environmental practices when serving these items in food venues. Also thinking about the community and how sourcing locally and regionally, and food practices as well, safety food practices to minimize foodborne illness. So it's a set of 4 different domains, and really thinking about where these guidelines, the title, it does say federal facilities, because they were really focused on federal government, but they've really morphed into lots of different settings. We've seen federal food service guidelines in hospitals and in healthcare facilities, colleges and universities, parks and rec centers, private work sites, and state and local agencies. And across many different food venues. It doesn't have to be just a big cafeteria with a salad bar and a hot bar and vending machines. It could be in grills, snack bars, concession stands, micro markets, coffee carts. And really, what are the benefits for adopting the FSGs? There's standards around really offering a variety of fruits and vegetables, whole grain options, plant-based proteins, which Katie will talk a lot more about, lower sodium meats in meats, entrees, and sides, and making drinking water freely available. But also keeping in mind, there's a section in FSGs that really thinks about the behavioral design aspect. You can make all of these healthy food options and beverages available, but there's a behavior component as well. And so there's a section about how do you influence decisions around the products that are prepared, where they placed, how are they presented and promoted, as well as priced, which I'll talk a little bit more about and how we have done this in Colorado. Next slide, please. So how has Colorado improved food environments in worksite settings? And, I'm really excited to share, we've been very successful in this area. But I want to start off by saying we could not do this work without funding from the Division of Nutrition, Physical Activity, and Obesity at the Centers for Disease Control and Prevention, CDC. We have been receiving funding from CDC since 2013. And I want to give a lot of credit to the FSG science team at DNPAO because they have prioritized FSGs as a nutrition strategy in their grants since 2013. And because of this, they've been funding many states, regions, and communities across the United States to make FSGs more widely available. And we're continuing this work in our current grant cycle. We were awarded another 5-year funding cycle that started September of 2023 and will go through September 2028. And so really, this is a testament to the work that CDC is doing around healthy food environments. And so what does a healthy food environment look like? And it's really important to understand how to operationalize these through data. So I started this work in 2018. I wasn't part of the first 5 years of funding, but in 2013, when we received our first round of funding, Colorado created the Colorado Healthy Hospital Compact. And it was a voluntary agreement by hospitals to improve their nutrition environments. And it was our intervention of implementing food service guidelines. And so the compact is a statewide initiative, and it's an agreement by hospitals to improve their nutrition environments for families, visitors, and staff. And the compact is made up of 4 programs: healthier food, healthier beverages, marketing, and breastfeeding. And each program is made up of a set of nutrition criteria that's aligned with food service guidelines. And the way hospitals participate is they have to complete an assessment. And as part of that assessment, the more standards they implement, the more points they receive, the higher amount of points they get. It correlates with the recognition level. And so platinum being the highest, gold, silver, then bronze. And Denver Health, Kristen Ellis will talk about how they've been participating in the compact. So in 2023, we decided to transition the compact to HealthLinks, and we created a food at work module. And this was really important for the state because we had been working with hospitals for 10 years, and I felt like we were really missing out in working with other work sites. And because of the great work HealthLinks does with employers, we were able to build a food at work module and to now really think about how do we work in other settings like colleges, universities, private industry, federal, state, or local government in Colorado, and be part of a larger food system that improves employee health beyond just food was really important for me. And so employers are able to participate by completing a food at work assessment that is very similar to the food service guidelines in the food service guidelines for federal facilities. And similarly to the compact, there is a scoring rubric where work sites can really identify how healthy is their nutrition environment. It was really important to me when I joined the compact in 2018 that hospitals make their own decisions around what they want to improve on when it comes to their environments. And so we really tried to create that with the food at work module. And we've just wrapped up our first year with HealthLinks, and we had 10 work sites complete the food at work module. And we're going to continue to partner with HealthLinks throughout the duration of this grant with our SPAN funding, the State Physical Activity and Nutrition Grant. So that is kind of what we've been doing in Colorado, and I will pass it off to David.
Thanks so much, Inka. I really appreciate the data-driven approach that the state of Colorado has taken to this work. We all know that you cannot improve upon that which you don't measure. And so when we're talking about food services, when we're talking about what types of food are available in the workplace, we really need to be able to get some data about that in order to make significant change, right? And so without the data collection aspect of it, it's hard to craft recommendations that are both tailored to the organization, but also based in the evidence and science we know behind the federal food service guidelines. And really great segue. Thank you for bringing up Denver Health. Next on our presentation list, presenter list is Kristen Ellis. Kristen is currently the workplace wellness strategist at Denver Health in Denver, Colorado, where she uses her background and knowledge in public health and health sciences to create and sustain a thriving workplace culture of health and well-being for Denver Health's almost 7,500 team members. So Kristen, I'll pull up your slides here.
Awesome. Thanks for the introduction, David. Excited to be here. Like David mentioned, my name is Kristen Ellis. I use she and her pronouns, and I'm the workplace wellness strategist over at Denver Health. I've been in this role a little over 7 years here at Denver Health, and in my role, I oversee all of Denver Health's employee well-being initiatives. So I sit on our human resources side, on our total worker health team, probably like many of you attending this webinar do. I earned a dual master's in public health and urban planning at the Colorado School of Public Health and at CU Denver. And I'm here to talk to you today about one of the initiatives that I work on. It's called our Healthy Hospital Initiative, and it's what we call our internal multidisciplinary work that's aimed at fostering and sustaining this healthy food and beverage environment. And we really use the food service guidelines and the work that Inka talked about with the Healthy Hospital Compact to guide that work. And so I'm going to share a little bit more about that with you all in the next slides. So you're probably wondering, what's Denver Health? I did see some Colorado people in the chat box introducing themselves, but for those of you who are not familiar, Denver Health is located downtown Denver. We were founded as City Hospital in 1860, which, fun fact, is before Denver was actually recognized as a city. And we were established to serve the healthcare needs of the rapidly developing city. And since then, we've grown to become a complete healthcare system. We proudly serve the Denver community at every point in their lives. Our catchphrase is "for life's journey." And we also provide care regardless of patients' ability to pay, which means Denver Health is Colorado's primary safety net institution. Denver Health cares for a very large percent of the population here in Denver. So roughly 33% of Denver's population annually receives care at Denver Health. We see almost 1 million patients each year. And fun fact, 1 in 3 Denver area kiddos are born at Denver Health. We also care for the needs of special populations like the uninsured, refugee populations, and those are things that we're really proud of. Next slide. So now that you know a little bit more about the makeup of Denver Health and kind of who we are and what we do, I'm going to kind of go through a brief history of how we put the federal food service guidelines into practice. So you just heard from Inka about the Colorado Healthy Hospital Compact, and that's really our origin story. That's how we started this work. We were one of the first partner hospitals to join the Colorado Healthy Hospital Compact back in 2014. So we've been working on this for quite some time. And the focus is really on ensuring that there are healthy options, healthy choices across all the areas where food is sold and served. Just like on that poll you just took, we have an inpatient menu, we have cafeterias, we have vending machines, we have a gift shop that serves food, and we also have a Subway. So thinking about where food and beverage pop up, we've got it in a lot of different places. And so we conducted our first Colorado Healthy Hospital Compact assessment back in 2015, I believe, and we earned silver status. And from that point on, we knew we wanted to continue this work and use that assessment as data, as a roadmap to help us understand what our goals are and how we can get there. After that, we wanted to go for the gold. I think we were a little hooked on wanting to improve and kind of move up in those rankings and recognition status. And so in the following years, we improved the availability of healthy food and beverages. So meals, entrees, side dishes, snacks, beverages, desserts, and we really looked closely at our marketing strategies. And that's how we kind of moved up to receive gold status in 2016. And you're probably wondering, what is she talking about, marketing strategies? So we could do a whole webinar just on that, but we did things like move healthier options to eye level. We tried to put healthy options at point of sale, so near the registers, and really use some of those evidence-based strategies to improve the visibility and availability of the healthier options while ensuring the not healthy counterparts were, not as front and center. Another example is on our vending machines, we didn't use any images of sugar-sweetened beverages on the front of the vending machines. We used all sugar-free and ideally water. So those are just other examples of marketing strategies. So then kind of moving forward in 2018, we actually eliminated the sale of sugar-sweetened beverages. That's kind of one of our hallmark initiatives, and then ended up earning platinum status in that same year. And so fast forward to where we're at now, since that time, we've utilized the food services guidelines and recently the Food at Work survey through HealthLinks to help us maintain this healthy environment for our patients, visitors, and staff. And again, it's this Food at Work survey that really helps us quantify and understand our current state and helps us develop a roadmap to where we want to be. And so you might be wondering, well, that's cool. Why is it important? Why does this work matter? Why should I care? Why should we want to adhere to federal food service guidelines too? And so for me, where I'm sitting in the workplace wellness role, I oversee employee well-being. So in my role, these are some of the main components as to why this matters and why our organization really cares. So it's no surprise to you that we spend like a third of our lives, sometimes more, at work. And so Denver Health believes that it's critical that our workplace is supportive of the health and well-being of our employees, and that we provide all employees with resources and opportunities to reach their highest level of health possible. And we strive to create this workplace where employee health and well-being is really woven into the fabric of our culture. My goal and what success looks like to me is that when an employee steps through our doors, they know and they feel that this is an environment that's going to help them reach their highest level of health, and that's going to support them in reaching that, and also care about their well-being and their family's well-being too. And so we obviously play a really unique role in the community, right? We're a safety net hospital. We see millions of patients every year. And so we really want to be role models for our patients and our visitors. We also know that we have to prioritize our own health and well-being before we can care for others. Healthcare is an extremely taxing work industry, and we know that our healthcare staff is really at a higher risk for things like burnout and compassion fatigue just based on the nature of our work. So we strive to take a proactive approach to that employee health and well-being, and we know that we have to support our greatest assets, which are our people, if we're going to show up every day and take care of our own community. All right, so I wanted to kind of break up the text heavy and talking slides and just show you what this looks like. So these are some images that I wanted to share that really kind of capture what this looks like at Denver Health. So this is just salad bar photos from one of our cafeterias. We actually have 2 cafeterias on our main campus. This is our main and biggest one, which is located in our main pavilions. And then David, you can actually hit the next slide, and I'll show you some other aspects of that cafeteria. So we have a bunch of different stations where food is prepared, made to order, but we also have simply to go, which are these, and these are more grab and go options. So it might look a little small, but we have like healthy grab and go, low-fat yogurt parfaits, sandwiches, wraps, salad, fruit, all the good things. And then David, you can hit the next slide too, and I'll show you just a little bit about how we kind of market and advertise that we're a sugar-free campus. So it's common to see signage that looks like this on our beverage coolers, vending machines, anywhere where we serve beverages. Again, this is not only to communicate logically, like, hey, we don't serve sugar sweetened beverages, but also it really helps in, again, making that culture. When people see this, they know that this is a place that cares about the health and well-being of patients, visitors, and staff. And then I think I might have one other picture. Oh, we've got a couple other pictures, but I wanted to wrap things up, and there will be more photos, by just kind of sharing some like successes and challenges, right? So we've started this and we've been at this for like 10 years, and that's not without unanticipated challenges, right? And so I will say we saw success and we're able to kind of move forward and do this work and improve the availability of healthy options by employing a multidisciplinary approach and really thinking mindfully about who in our organization needs to be involved in this, and kind of looking broader than just our food services team. So our multidisciplinary team internally is composed of food service folks, but it's also comprised of our public health team, folks like myself in human resources, our patient experience team. And so I think it just goes to show that before kind of sitting down and starting this work, it's really important to think through who needs a voice at the table and who should be involved. Also leveraging your partnerships with external partners. So our food services, our canteen for vending, and then Sodexo in our cafeteria and inpatient areas, and really having strong partnerships with them and making sure that they know what your goals are and what you're trying to do. Here in Colorado, Canteen was pretty familiar because a lot of their clients were like elementary schools or middle schools, and they were trying to do the same thing by bringing healthier snacks to their vending machines. But we really had a concerted effort and a strategy to work with those vendors to make sure that they knew where we were at and what we were trying to do and make the partnership work. And that kind of leads into the third bullet, being able to explain your why and the business case for why you're doing this, and ideally connecting that back to your organization's mission, vision, and values. There were some struggles, right? Some challenges to overcome. And I think the two that I wanted to highlight here have to do with, one, the belief that healthy food is more expensive or not tasty or not desired. I think there was this strong misconception when we got started that if we brought in healthier food options, that sales would plummet and that people wouldn't want that. And that's not what our customers want. We were able to overcome this through surveys. We've done a lot of tasting events. We used to have Wellness Wednesdays where we would hand out free samples of some of the healthier entree options outside of the cafeteria. And we did that for years. And then second, these changes don't happen overnight. I think I've said it a couple times already, but we've been doing this work for over 10 years, and now we're kind of more in like a maintenance phase. But my best advice is to kind of isolate and pick some initiatives that are important to you. For example, for us in 2018, it was sugar sweetened beverages, right? And so to be laser focused on just a couple things and not try to disrupt and overhaul your entire food and beverage environment overnight. All right, well, that's all I have for the group today. So thank you so much for taking time to learn about Denver Health and a little bit about what we're up to. Excited to answer any questions you might have. And thanks again for listening.
Thanks so much, Kristen. There were so many elements about the total worker health approach that you incorporated into your presentation, which we really appreciate. Thinking about starting with the data, leaning on what Inca started with. And I love the fact that you all sought to improve, and there was some competitive aspect in that, wanting to reach the next badge or attainment level. A lot of workplaces really like those competition aspects of the things that they do. And so that was a great behavioral change element that you incorporated as a team. But then also talking about how you're role models and leaders in this space, right? We know the importance of leaders demonstrating support overall for health and safety initiatives, and you're taking a community leadership role in how you're offering food choices at Denver Health. You also talked about having an interdisciplinary team of subject matter experts that help inform the selections of the food choices you have available. So just really appreciate you touching on so many aspects of a holistic total worker health approach in your presentation and with what Denver Health is doing. And finally, this idea of how to engage people through behavior change ideas like putting healthier food options at eye level. And I know that some of our participants are going to have some questions on other ideas to stimulate people to make those healthy food choices. And so we'll come back to some of those questions that are already popping up in the Q&A. With that, we're going to shift gears a little bit, and I'm going to introduce our third speaker of today, who is Katie Cantrell. Katie is a social entrepreneur who's passionate about creating healthy, sustainable food system. And as the founder of an educational nonprofit, Greener by Default, Katie spent a decade leading food policy workshops at universities, government agencies, and Fortune 500 corporations. She's now utilizing this expertise to implement plant-based defaults in institutional food service as the co-founder and CEO of Greener by Default. Katie holds a bachelor's degree in psychology from UC Berkeley. Katie, thanks so much for joining us today. I'll let you share your screen as you're able.
Great. Thank you so much for having me. Really honored to be here with you all today. All right. Can you see my slides?
Looks good. Looks good,
Okay,
Katie.
great. Thank you. All right, perfect. So I know I don't have a whole lot of time, so I'm just going to dive right in. So there are a lot of issues with our current food system, as I'm sure most of you know. Across all preventable risk factors for disease, in the United States, poor diet is now the leading cause of death, associated with more than 500,000 deaths per year. And the food system is also one of the leading drivers of climate change. So even if all other sectors, energy, transportation, buildings, became completely carbon neutral tomorrow, but we keep eating the way that we were eating, we will still surpass 1.5 degrees of global warming by 2050. The good news is that there is one solution that addresses both of these issues simultaneously, which is eating more plant-based and plant-forward foods. So plant-based diets are associated with lower risks of many of the leading causes of death, and their carbon footprint is half that of animal-based meals. Plant-based foods are also more inclusive. Now, I know that food obviously is a deeply personal issue tied to our family and our culture and our health. But the standard American diet with meat and dairy at the center of the plate at every meal is not necessarily the most inclusive way to serve food for the tens of millions of Americans who are lactose intolerant, for those who are part of a religion or culture that encourages vegetarianism or restricts specific animal products. A significant portion of Americans are trying to eat less meat and more plant-based for health reasons. And BIPOC Americans are actually nearly 3 times more likely to identify as vegetarian compared to white Americans. So, contrary to some of the stereotypes about vegans as being this niche group, there's actually a broad array of different populations that may be seeking more plant-based and plant-forward options for a variety of different reasons. So serving more plant-based foods can actually benefit your triple bottom line by helping to meet carbon reduction commitments while saving money, meeting DEI commitments while improving employee health and productivity, and helping to attract and retain talent. It's because we are seeing that young people especially are really looking for more sustainable and more healthy options. So to give a demonstration of what this can look like and what the impacts can be, we worked with New York City Health and Hospitals to implement a plant-based default for patient meals in the 11 public hospitals in New York City. So they have 2 daily chef specials that patients are offered. If they don't want either of the chef specials, there's a static menu of options that they can choose from. And so now both of those chef specials are plant-based. If patients don't want either of those, there are meat-based options that they can choose from. So that's the beauty of defaults, is that they preserve freedom of choice. There's options for everyone, but they help to normalize plant-based foods. And so about half of all patients are opting into one of those plant-based chef specials. There's very high satisfaction ratings for those plant-based meals. They're saving almost 60 cents per meal, or about $500,000 per year, transitioning over 800,000 meals a year from meat-based to plant-based. And as a result, this program has cut the carbon footprint of their entire food service program by 1/3. So today I really wanted to focus on sharing actionable strategies for you, examples of what defaults and other behavioral nudges can look like in different food service environments. And I'm focusing mostly on events and catering, like for meetings, because I figured that would be the most universally applicable, but we actually do specialize in applying these strategies to cafeterias and hospital patient meals as well. So the most effective and easiest strategy is if you are having an event and people are RSVPing, just flip the default. So usually it's just assumed that people want meat unless they specially request a vegetarian option, which only vegetarians are going to bother to do. So you can make plant-based the default and give people the choice to opt into meat. So you can see what that looks like here. You can say something like, on the RSVP form, in alignment with our commitment to sustainability and inclusivity, attendees will be served plant-based meals by default. If you prefer a different choice, please indicate your dietary preferences below. Now, it may seem like a small switch, but it has a tremendous impact. We actually partnered with researchers at Harvard and UCLA to study the impacts on student meal choice at on-campus events. In the control condition here, meat was the default, just like pretty much every event, and students could check a box to request a plant-based option. You can see a little less than 20% of students did request plant-based, but about 80% stuck with the meat default. Then for the study, they flipped the language to make it like what I just showed you. So plant-based was the default and people could request meat. And about 1/3 of people did request the meat-based option, but 2/3 of people stuck with the plant-based option. So this is a nearly 50 percentage point increase in the number of people choosing plant-based meals simply by changing the language on the registration form. And again, critically, if this had been a fully vegetarian meal, then that third of people who wanted a meat-based entree probably would have been upset, but they had their needs met, and the rest of people were happy to stick with plant-based. So another way to think about these results is like this graph here. So, on one end of the spectrum, you have the vegans. These are people who are going to go out of their way to request plant-based. They're going to settle for a sad hummus wrap or side salad, whatever they can get. On the other end of the spectrum, you have the meat lovers who are going to complain if there's a meatless Mondays. But really, most people fall into the middle here. These are the flexitarians. Again, people who are not going out of their way to request plant-based options. They're not going to settle for a side salad if there's a tastier meat option available, but they are happy to eat plant-based if it's delicious, if it's abundant, if it's normalized, if that's what the other people around them are doing. And so this is really the focus of our strategies, is making it easier and more appealing for everyone to choose plant-based options, getting outside of this paradigm that vegetarian food is just for vegetarians. So another way to do this is to shift the ratio, serve 2 plant-based entrees for every meat-based entree. And it helps to make sure they have different flavors. Often there'll be a meat and veg version of the same dish, but what happens when you do that is the omnivores will choose the meat dish and only the vegetarians will choose the veg dish. So here's an example of what I mean. This is a sample menu with Mediterranean food. You can serve falafel, mujadra lentils, za'atar chicken, and then have the side dishes be plant-based. So there is meat available for those who want it, but there's an abundance of really delicious and appealing plant-based options. So people will just naturally fill their plates with those. Placement is also extremely important, both in buffets or if you're setting out food at a catered meeting or on printed menus. So placing entrees first encourages people to, again, fill up their plates with the plant-based entrees. If you place meat at the end and keep it simple and in smaller servings, then it becomes more of a garnish. So rather than serving a whole chicken breast, just serve shredded chicken with a smaller serving utensil, and then it becomes a garnish. So people will naturally take smaller serving portions. It's also really helpful to have dairy on the side, with soups and salads and entrees. So people can add it on if they want, again, in a small serving bowl with a small serving utensil. And this, again, is also more inclusive. It's a great strategy for nuts and gluten too, like croutons, so that people with allergies have their needs met. You don't need a whole separate entree for them. And then people who want to opt into these things have that option available to them. A really simple but effective strategy is looking at the names of dishes. So avoiding putting terms like vegan, meatless, low calorie, or healthy in the names of dishes. I know this is kind of sad, especially the healthy one, but I was just today at Google Food Lab, and one of the speakers, sorry, it wasn't there, it was somewhere else, but I was at a food conference, and one of the speakers was saying that the heart healthy option, we've seen in studies that it decreases the take rate. And actually we are conducting a study soon with a food service management company that will look at this impact with hospital patients. There have been ample studies done of the general public showing that when you call an option healthy or when you call it vegan or plant-based, what that signals to diners is this is going to taste like cardboard. It's not going to be filling. It's not going to be indulgent. I'm going to be hungry in 20 minutes. I'm not getting my money's worth. And so if we just avoid those descriptors and instead we focus on what people will be getting, all the delicious flavors and the delicious ingredients, that really encourages people to choose them. So just as an example, instead of calling something a vegetarian burrito, you can call it a sizzling Southwestern black bean burrito. And there's really fantastic resource called the Edgy Veggies Toolkit, which was created by Stanford University and Menus of Change. They have whole lists of different types of really appealing descriptor words that you can use in the titles of dishes. And there's actually a research paper that was published in conjunction with this toolkit that found that using these names increases both the selection and the consumption of vegetables and healthy options. And then finally, of course, it's really critical that the food is delicious. So it's really important to work with the food service management company, the culinary team, with the caterer to ensure that the plant-based options are familiar, flavorful, and filling. So we actually have resources on our website with more details about how to Make sure that the plant-based options are really tasty. So greenerbydefault.org/events. And again, if you are part of an institution that has a cafeteria, we do more in-depth pilot engagements, and we can also help you track the shift in procurement that is achieved by these strategies, and then calculate the carbon savings as well. So if you're from a larger institution with a meal program, we'd love to connect with you. Thank you.
Thanks so much, Katie. Really appreciate it. So I'm going to invite Kristen and Inka to come back and join Katie and I for this Q&A portion of the event. Such interesting information, Katie, about really behavioral dynamics and in terms of how we market and sell and talk about and offer a plant-based options. We will be sharing the slides from today's presentation in the follow-up email, so you will get a link to all the slides in the presentation as well. So really appreciate the three of you being here. I'm going to start with a question, Inka, that you indicated we'd be okay to answer live. And I'm going to go into some of the answered questions for this portion of the dialogue as well. So the first question here comes from Michael, participant, saying that, maybe you answered that already, that the food service guidelines were from 2011. They were a little bit dated. Is there any opportunity or is there any thoughts about updating those, or where are we at with updating federal food service guidelines? Inka, are you able to answer that question for us?
I can answer half of it. I don't represent the advisory committee that, it's over 60 different organizations or people that help inform them. They are based on the dietary guidelines. And so those come out every 5 years. And so they did look at the 2015 to 2020 dietary guidelines to make sure that they still were in line, and they were. And now that we're in, we're wrapping up the 2020 to 2025. They're coming out with the recommendations for the 25 to 30. I know it's a little complicated, but it hasn't changed a lot because the science behind the nutrition criteria for the entree side, sodium, like the sodium for the entree sides, and the content for beverages has sort of stayed the same. But I think what really we should be thinking about is the opportunity for policy, whether it be small p policy or at an organizational level, or city, municipality, or state policy, to think about the impact of food service guidelines.
Great. Thanks, Inka. So it sounds like, looking at considering these in conjunction with other work around healthy people and food guidelines that is going on. So they are being reviewed and potentially changed. I want to ask this next question of Kristen and Katie. Kristen, maybe I'll start with you. We've already sort of typed in a little bit about it, but oftentimes when we're talking with companies about healthy food options, there's this belief, and perhaps it's a myth, that it's going to be expensive. It's going to be more expensive for the company. It's going to be more expensive for the customer. And, already people are, constrained with their budget. Sometimes we think about those healthy food options at grocery stores as consumers thinking about that things are more expensive. So how do you deal with that, whether it's a myth or not, perception that going healthy is going to mean more expensive? And I'll start with you, Kristen, and I'll follow up with you, Katie, as well.
Yeah, great question. Well, I think you do that by walking the talk, right? Debunk the myth, show them. So, for example, before we removed sugary sweetened beverages from the Denver Health campus, all of our sugary options were actually priced higher than the healthy zero sugar counterpart. So debunked the myth by doing it, right? We
Right.
also do different specials, healthy specials. So we have Wellness Wednesdays, Meatless Mondays, fun things like that. And we show them that the healthy options are either priced the same, if not lower, than the other entrees, and make that a priority. I know that our team has worked with Sodexo, and we've worked with Canteen to ensure that that's possible. I can't really speak to the mechanics of how that works with the pricing, but in my role from where I'm sitting, we do it by showing them and demonstrating that health and well-being and having the healthy options is such a priority to us that we're willing to make them at least exactly the same as the less healthy counterpart, if not cheaper than it.
Great. I really appreciate that. Before I have you respond as well, Katie, I want to mention that we have been working with a large manufacturing facility that's a multinational corporation, and they put into place exactly what you were saying. So this is not a hospital. This is not someone that sells meals. This is a manufacturing facility that has a cafe as on site. And what they decided to do is they were able to use some of their corporate wellness dollars to subsidize the cost of the healthier food options. And so when the individual is choosing something from the cafe, at least there's price parity, if not the healthier option being a little bit less expensive when they go up to the food counter. So I know that not all of you can put those kind of subsidies in place. This particular manufacturing facility, they're piloting it for a year. They're working with their food vendor to have reduced price on a few healthier options. They're strategizing days of the week that they can highlight those so that more people are choosing them and they can start to see how those things taste. Katie, I'm going to ask you the same question. The idea might be, the perception might be that plant-based options are more expensive or healthy food options are more expensive, or maybe people won't like them. I think you talked about that a lot in your presentation already, but what about this cost aspect? What have you found in working directly with employers about the price of making this switch to more plant-based offerings?
Yeah, it's an important question. And I will say that it varies a lot depending on the food service environment. So if you're purchasing from a caterer, they are likely going to charge the same amount, potentially even slightly more for plant-based. For consumers in the grocery store, it depends on what options you're serving, and the same for food service. A lot of the more plant-based meat analogs can be more expensive, but actually whole food plant-based proteins are the cheapest sources of proteins. Historically, there's been kind of stigmas against them. They're seen as peasant food because they have been the staple diets of working people around the world. So things like beans and lentils and rice and potatoes, tofu, those are actually the cheapest proteins that there are. So what we've seen when working with food service management companies like New York City Health and Hospitals, this can actually be cost savings, especially if you're replacing meat with, again, beans and lentils and some of these culturally appropriate whole food plant-based proteins.
Great. Really appreciate that as well. I'm going to ask this question in reverse order. So we're going to start with Katie, and then we'll go back through Kristen and Inka, who's already responded to it. But I think a lot of our audience understands the importance of this. Maybe you're already making healthier food choices in your personal lives. If you were to give folks one thing to do in coming out of this webinar, and this comes up a lot, right? There's a lot of options on the table here for what we've talked about. But let's say if someone's ready to make one next step based on what we've learned today. Katie, what would you recommend for someone to be the next thing they do after digesting the information from this webinar?
It's a great question. I think there is no one size fits all because it really depends on, where you currently are at your workplace and also what your priorities are. I thought that was a great point that Kristen made about, figuring out what is important to you will really dictate where you start first. I will say, in terms of the strategies that I talked about, tasty titles, I think, is really the most bang for your buck. So look at your menu. If you currently have a vegetarian this or plant-based that or healthy or meatless this, take that out and add in a really exciting flavor descriptor. It's super easy. There's no cost to doing that, and you'll automatically see the take rate for that dish go up.
Really appreciate it. Kristen, what are your thoughts? One thing that someone's going to do after, and I know that there's no one size fits all approach to this, but someone's ready to act after attending this webinar. What would you recommend they do next?
Yeah, I think it's find your people, right? Maybe that's an executive sponsor or a leader or your direct supervisor, someone who's going to help you champion this work and move this initiative forward. We had an executive sponsor back in 2014 when we decided that this was going to be a priority as we moved through the Healthy Hospital Compact initiative. And same thing with our internal work group. This is likely not something that one person can champion and do alone. And so I'd say identifying your people would be my best advice for a next best step.
I love that. So we've got, look at the words and the marketing that you've got for the descriptors of the foods that you're offering. Find your people. I love that. Where are your collaborators, your partners, and your colleagues? Inka, in the chat, you mentioned get some data as the first step. That kind of aligns with your presentation as well. Is that what you want to recommend to people as the next step? Find out what's currently going on?
I think one of the reasons why I was so successful with the hospitals I've worked with the last 6 years is I never went in and said, you need to adopt the food service guidelines. You have to do this. You need to create a policy. You need to do a contract. I went with, are you interested in knowing how healthy is your nutrition environment? And by taking this, the compact assessment and now the HealthLink survey, taking that first is some time commitment. I'm not going to say it's 5 minutes, but then you can actually see the data. You can actually see, wow, you know, I had a hospital that completed, Good Samaritan Hospital completed an assessment in February of 2021. They came in at silver. The food service director was shocked. You know, she really thought she was doing a good job, and she was. And then in 5 months, she submitted another assessment and came out at platinum, the highest level of achieving, by making some changes to her entrees, adding some healthier options for beverages, swapping out some of the desserts for smaller portions. Like, there's small things that you can do that really go a long way. And unless you have that in front of you, you don't know where to start. And so I think it's a great way to start with that and say, I want to work on sides and work on that. And it doesn't happen overnight. Like Kristen said, it takes a long time, leadership buy-in, community buy-in. So it's a collaborative approach.
Thanks, Inka. Really appreciate the perspectives here today. For those of you that are looking for the link for continuing education credits, it is available in the chat. It should also pop up as you're leaving today's webinar. So the biggest thing is looking at what's currently offered and making small, slight modifications based on where you are, who you have access, who are your collaborators, what your budget is, etc. I'm going to go a little bit off script for my last 2 points and questions. One is, the first one is, we're just coming out of the Halloween season where, at least in my office environment, the common theme is to dump extra candy on the break room. And so if I have one suggestion for you businesses out there, for your employers out there, is have some sort of guidelines. And I'll admit we don't do this great at our own centers. If you're going to add candy to the break room table, make sure that there's fruit or vegetables or some other healthy option, right? This is about treating people like adults. And so when we walk up to the break room table, if the only thing available are donuts or candy, well, that's what people are going to choose. But if there are multiple options available, just like we're talking about with these strategies here, well, then people can be adults and they can choose whatever fits best for them. So not ban dumping, but diversify dumping on the break room table. And the other thing that's really critical and important for me to get across to you today is the holiday season is coming up. Generally, and as Americans and throughout the world, we increase our alcohol consumption around the holidays. We also increase the types of high-fat foods, high-sugar foods that we're eating. And so I want everyone to think about which options around their holiday table they can start to infuse some of these principles as well, right? Whether that be through a corporate holiday party that offers mocktails in addition to a full bar, or offers a special mocktail drinks, or perhaps you're ready to remove alcohol in general from your holiday party. Vice versa, if you're looking at potluck events or your own personal holiday experiences, where can you infuse more plant-based options? Where can you, get more exciting about creative elements in your holiday offering? So just a couple of thoughts for everyone as we come out of the Halloween season and into the winter holiday season as well. So as I mentioned, the link for continuing education credits has already popped up. For you all, I really want to thank and send my gratitude and appreciation to Katie, Kristen, and Inka for participating in today's webinar. I thought it was really a fantastic discussion on this topic. We have our 7th and final webinar from the HealthLinks webinar series coming up on December 10th, which is World Human Rights Day, and it's about violence at work. So this is going to be a difficult topic for some. We're going to talk about the prevalence of violence at work, especially as a killer, perhaps often a silent killer of women in the workplace. So you will receive a link to register for this specific webinar when you log out of today's session. But so please join us for our final webinar of 2025, the conversation about violence at work. And finally, thank you for joining us. Please complete the feedback survey. You will receive links to the presentation and the recording of today's webinar in our follow-up email. and get engaged. We're going to send you a link to join HealthLinks, and perhaps you're ready to take that food at work survey that you've heard so much about today. We're going to send you a discount access code for being able to do that as individuals who have participated in today's webinar. Good luck with your healthy food initiatives. We know that this can be a really big undertaking, so take it one step at a time, and please lean on the HealthLinks team and the other individuals on today's webinar for some suggestions and advice. You're not out there alone. We're here to partner with you on offering healthy food options at work. So thanks again to our speakers and to all of you for participating today. We really appreciate it.